Started.
Okay, ma'am. Ma'am, any other slide?
Hello.
Starting with 10 minutes time.
Okay. Hello, my name is Arati. I'm one of the doctors in the gynae clinic today. Uh, could I please check your name and age, please?
Yeah, I am Swizzle and I'm 33-year-old.
Mm-hmm. What would you like me to call you?
Swizzle is fine.
Okay, thank you, Cecil. Cecil, I understand that you're here to discuss about your reports and also to talk about the heavy bleeding. Is it correct?
Yeah.
Mm-hmm. Cecil, also from the notes, I gathered that you had a miscarriage 12 weeks back. I'm so sorry to learn that from your notes. How are you recovering, my dear?
Yeah, doctor, actually, I was planning to get pregnant. It was difficult initially. After some time, I got pregnant, but I lost my baby at 6 weeks. It was traumatic, but I am recovering.
And is this your first miscarriage?
Yeah, it was my first miscarriage.
And could you please tell me a bit more about that, Swizzle? Sorry to ask you,
Uh,
but
it's okay, doctor. Actually, yeah, this was my planned pregnancy. I took time to conceive also, but once I conceived, uh, everything was better off. But at 6 weeks, I lost it. It was just a spontaneous abortion. I aborted on its own. Nothing was done, and my urine pregnancy test was also done, which was negative now.
okay, Cecil. Thank you for telling me that. Thank you. So, Cecil, could you please tell me a bit more about the heavy periods? Since how long you're having the heavy bleeding?
Yeah, doctor. Actually, these heavy periods are there since last 2 year, but recently, since last 8 months, they're quite heavy. They're little painful also. Initially, I was not being investigated, but after the loss, I think they suggested I need to do a ultrasonography, and I am here to discuss about that only.
Okay. So, Cecil, so for the past 8 months, how many days you bleed?
I bleed 4 to 5 days
Okay.
regularly, but
Mhm.
it is pretty heavy. I need to take 4 to 5 pads in the day and 2 to 3 pads
Okay.
in the night. I I had a trouble trying.
Oh dear, it sounds really dreadful. And you told me that you are having some pain as well along with the bleeding.
Yeah.
And have you tried anything for the bleeding yet?
Initially, the GP gave me some tablets to control the bleeding. After
Hmm.
that, I conceived, and now this is I'm here.
Okay. And any bleeding in between your periods?
No.
Okay. And how is this bleeding affecting your quality of life, Susan?
Yeah, doctor, I need to take off when because whenever I go during my
Mhm.
work time, I do need to take off from because of this
What job
heavy
you do?
bleeding. I'm accountant.
Accountant. Okay. So, Susan, one intrusive question. Are you sexually active?
Yeah, I'm active.
Any, yeah, any bleeding after sex?
No.
And all your smears up to date and normal?
Yes.
And you have any medical conditions, any thyroid problems?
No.
Okay. And any operations?
No.
Okay. Any allergies?
No.
And how is this affecting your mood generally, Cecil?
No, it's not affecting my mood.
Okay, that's good. So, Cecil, thank you for sharing all this information with me. Is it okay if I quickly feel your tummy in the presence of a chaperone? Will that be all right?
Okay.
I just wanted to check, Cecil, whether I can feel anything on your tummy, like any masses. And also, I wanted to ask you, Cecil, have you felt like any heaviness on in your tummy?
No.
No, okay. And there is no trouble in your water works or in your bowel works.
No.
Okay, very good, Susan. So, Susan, I have got your report with me, and I have confirmed that it is your name and NHS number. So, the blood test is showing that you are quite anemic. Your hemoglobin is very low. It's only 8 grams. Ideally, we would
Okay.
expect it to be at least more than 10 to 11 grams, more than 11 grams.
Okay.
So it shows that your bleeding is really heavy.
Oh yeah, doctor, it's really very heavy.
Yeah. So, Cecil, do you have like any anemic symptoms, like any heart racing, or you're feeling tired all the time, anything like that?
Yeah, I keep on feeling very low, tired, and do not have an
Right.
energy to do any work. And sometimes I do feel this palpitation or a throbbing heart.
Okay. So, Cecil, what we can do is we can start you on some iron tablets today, and then we will see how you are improving. And also, I would advise you to start taking some iron-rich diets like green leafy vegetables and dates. So that will also help to your iron.
Oh, that's great, doctor. Thank you.
Okay. Cecil, coming to your ultrasound report, um, and it is showing that there is a fibroid. So if I'm drawing this picture, Cecil, if this is your womb, your tubes and the ovaries, okay, so there is a 5 centimeter fibroid inside the womb, what we call submucosal fibroid. Have you heard about this before?
No, doctor.
Okay. So, Susan, this is not a cancer. This is just a growth of the muscle itself. But this can cause, heavy periods. Exactly what you are, going through at the moment.
Okay. Okay.
Okay. So, Susan, there are ways which we can treat it. Are you okay for me to explain it in a bit more
Yeah,
detail?
actually, I wanted to know because I'm planning to get pregnant. We are planning to start a family, and this
Yeah.
is actually bothering me.
Yeah. So, Cecil, usually the ways which we can treat the fibroids is by either we can give some tablets and also we can do like some small operation. In the tablet, I know that you already had taken tablet from your GP. Is that called tranexamic acid?
Maybe.
Okay. So you can try that. Okay, but we can also give like other contraceptive pills, like two hormone pills and also single hormone pills, but that may not be suitable for you because you are trying to, trying for a pregnancy. Okay,
Okay,
so
yeah,
that,
doctor. Yeah,
yeah,
yeah.
yeah.
Mm-hmm.
Are you with me so far, Susan?
Yes, yes.
Okay. So that contraceptive pills are, you know, are not going to be suitable, but you can try tranexamic acid, and also for the pain, you can have mefenamic acid also. Have you tried that
Okay.
before?
Yeah, there was some painkillers also.
Okay. And the next, what we could do is, Swizzle, we can do like a camera test, what we call hysteroscope. And through that hysteroscope camera test, we can try to chip this fibroid away.
Okay, so you're suggesting a surgery for me.
It is a small operation. It can be done either as an outpatient in clinic, or we can put you to sleep. It depends on how well you can tolerate the procedure. So the benefit is that, Suzel, if it's an outpatient, or even if we are going to put you to sleep, you can, we will be able to see inside the womb. We can remove this fibroid, which is causing this heavy bleeding, and you can go home on the same day.
Oh, that's great. Very great.
Mhm.
So when can I plan this surgery then?
So, Swizzle, first I would want the hemoglobin to come up a bit, around 10. So, we can start the iron tablets, and also I can arrange for the iron infusion in our department. So, what I would do is, Swizzle, I will discuss with my consultant and see when we can put you on the list, and then we can, arrange for the iron transfusion, and we can, try to do this procedure. There will be a waiting for this procedure, Cecil, because it's not like, I know that it's an urgent thing for you, but according to a waiting list, this is not like a top priority. So at least, there will be some waiting, but hopefully we will be able to do that in 3 months time. So if you continue to take iron tablets in that time, I'm expecting your iron will also come up.
Yeah, doctor, it will come up, but then again I will bleed a lot.
You mean, oh yes, that's true, Susil. So that's why I'm thinking of, speaking with my consultant and trying to get an iron infusion also sorted. So what we can do is, when we're coming for the pre-op, we can try to arrange for this iron infusion if your iron has not, hemoglobin has not come up.
Okay, okay, yeah,
Okay.
yeah. That's
So
great.
so the risks of this procedure is, as you said, that there can be bleeding, infection, uh, pain. Depends on whether you choose to do it as an outpatient or put you to sleep. And sometimes we may go make a hole on the womb called perforation. That can also happen. If that happens, we may have to do a keyhole and make sure that we have not injured any bowel or bladder or any blood vessels.
Okay, okay.
And if
It
it, yeah.
sounds little scary, doctor. Yeah, it sounds little scary. Yeah, it's okay, doctor.
Oh, Oh, I'm so sorry, Cecil, but we will take all necessary precautions to avoid any of these complications.
Okay.
Okay, Cecil, other options are not really suitable for you, like, endometrial ablation and uterine artery embolization. These are not very suitable for you. And finally, hysterectomy. These options I'm not even discussing because these are not suitable options in your case.
Okay.
Okay, so Susan, anything else you want to discuss today?
No, doctor, thank you. That's really great. Thank you.
So, and Susan, and once this fibroid is sorted, so I don't think the fibroid is the cause for your miscarriage. Maybe, may not be. I'm not sure. And if you're struggling to get pregnant, in the next 6 months, so I understand that in a total you might have tried for 1 year. Then the GP can do further investigations for you and your partner, from the fertility point of view, and if needed, then we can refer you to the fertility clinic as well.
Okay, thank you, doctor.
Okay, so Cecil, I will give you some information leaflets about this procedure, and also regarding iron infusion if at all needed, and I will give a prescription for the iron.
Okay. Okay.
Okay. And for meantime, I can give you some tranexamic acid and mefenamic acid until we plan the surgery.
Thank you, doctor.
Okay. So I can bring you back to clinic and then we can, discuss about the pre-op and consent on another occasion.
Yeah. Thank you.
Okay. Thank you, Cecil. Thank you for your time.
Thank you. Okay. Uh, so your own feedback, then I will give my feedback. Anybody wants to add any point? Very well done, Aarti. Very well done. Only concern I'm having is time management. If you could have finished all those things within that 10 minutes time, excellent station.
Okay, ma'am. Ma'am, is the bell rang or?
Twice rang. I gave you two time.
Okay,
Okay.
ma'am. Sorry.
Extra 1 minute. After that also you took another 30-40 seconds.
Oh,
Okay.
okay, ma'am. Mm.
Very well done. Very well. Your own feedback, then we will discuss about somebody else.
Ma'am, I was not sure whether I should talk about other options and,
No, the way, yeah. Actually, see, applied clinical knowledge is for that only. That you need to tell her the appropriate mode of treatment which applies to her. So the way you had told her that this is a procedure of choice in your case, and the other methods, something like uterine artery embolization, MRI FUXU, or open surgery. So these are not made for her. Okay, so they are not the
Mm.
recommended procedure, or they are not the suitable procedure in her case. So you had rightly said, only concern I would have added a GnRH. You had
Yeah.
asked me to wait for 3 months.
Yeah. Mm.
No, this is
Okay,
the thing. Yes, yeah. Two-step
yeah, I
procedure.
gave you two-step procedure, one thing, and one thing. It's okay if you will not able to tell her two-step procedure. One thing is very sure, that we are waiting for 3 months. So that waiting for 3 months, don't you think I will bleed whatever iron you are going to give me?
Yes.
I'm going to
Mm.
bleed. So that GnRH will take care of these things.
Yeah.
Definitely, you are going to require a surgery, which will the more route of surgery will be. See, hysterectomy is a definitive, so it is out of question. The surgical modalities are different, either a radiological or interventional, like uterine artery embolization or MRI guided procedures. But those will not be suitable, since it is a submucosal big fibroid. Okay, it's big fibroid,
Mm.
and they are having also its own risk and complications, something like uh, embolization syndrome, where you will have pain, fever, and discharge, prolonged discharge, and risk of hysterectomy also. A myomectomy, so yeah. So this is basically a myomectomy, which we will be doing under hysteroscopic guidance through camera test. Yeah. So this is a modality what you had given. You had told very precisely the risk and pros also. You have to explain. You had explained that also. And add-on thing what I was expected was GnRH, because you are keeping me
Dr.
awaited for
Bajat,
Okay, ma'am.
3 months. Yeah.
Yes, ma'am.
Yes, dear.
Dr. Bajata, I have one doubt. Like the patient is anemic and she is having a bleeding as well. A urine acetate can be offered or not, ma'am?
Before ulipristal acetate, we can go for a the
A
conventional
liver
treatment.
function test.
Yeah, conventional treatment will always be the best thing, because GnRH for 3 months we can very easily give, and it is recommended. Whenever we are
Okay.
waiting for the fitness, okay, you can explain,
Mm-hmm.
you can tell her that there are certain medications which we can give to buy a time. So one is ulipristal acetate, another one is GnRH analog. So one of these we
Mm.
will be giving you. You can just take a name, and
Okay. Yeah, yeah.
you
Okay.
can take a name. There is no harm in taking a name, but this is only for time buying thing. We are buying a
Time
time.
bank, yeah.
Yeah, we are buying a time so that your hemoglobin will be improved and it will go up. I had explained it in my answer key also, but this would have been the only point what I had expected. A very good on communication. We were very crystal clear. One thing I wanted you to avoid, Aarti, is my dear and dear. You not
Okay.
use those sentences.
Okay,
Okay.
ma'am.
And
Mm.
one thing what I had noted, concerns you missed out. Okay. I was giving you hint as I was, because you were knowing that station. That's the reason you had asked addressed my concern by late. but you have
Mm.
not asked my concerns anytime.
Mm.
Okay. uh, the history okay, the relevant history which was needed in this case was 4 minutes. After that you had offered me examination, and the again pressure history you asked me, which was by 5 minutes, and then you asked me again some history. So total history taking time was 6 minutes, Aarti.
Mm.
Okay, so even if you were very good, very appropriate on the task, you had only 4 minutes.
Mm.
So you have to reverse this. You have to reverse this way. That means 4 minutes of time where you are going to gather a history, and then 6 minutes of time to collect. Hmm?
Okay, ma'am.
So you can speed up. The communication was perfectly fine. Only thing here, you can speed up your communication speed.
Mm.
Hmm? That is what I wanted here. Uh, check knowledge about the report when she was there, at least check whether I am aware about a report. Something about that, okay, is
Okay.
needed. Okay. Iron infusion or iron tab supplementation, it is one and the same thing.
Mm.
Once you had explained it, go ahead, go to the next level. Okay. You used iron infusion twice or thrice. So here you
Yeah.
can just, once you have explained, that means it has been tick box. You do not repeat it again, thinking that whether the examiner has tick box
Yeah.
or not. Okay. So
Mm.
because we wanted to save our time, how we can save our time with these small small things only. Hmm?
Okay. Mm.
Only thing, yeah, so that GnRH was missing in your
Yeah.
case. Apart from
Mm.
that, I had written very good on communication. I will give full on communication. Okay. Anybody wants to add anything in this task? Shall we discuss the answer key? It's same what she has
I mean, this
given.
is the only point we have. Yes.
Ma'am, Dr. Akshita here. Just I wanted to add, should we also explain her that during the time of hysteroscopy, there we might not be able to get the fibroid out in one sitting, and
In
we
one
might
setting,
require,
yes,
yeah.
you can explain that it might be difficult at a time, so special imaging she might require. Okay, so that one point also we can add. uh, See, on ultrasonography TBS, 3D TBS also we can see sometimes special imaging to see whether exactly it is localized, and if it is difficult to access in single seating, then we, in that case we might require two sitting. So this GnRH will help us to reduce the size of the fibroid also, so it will be easier to remove. Yes, you can tell her.
Okay, ma'am. One more thing regarding, should we also involve hematologist here in any change charts?
No, hemoglobin 8 gram percent, we know the reason.
Hmm. Okay.
See, they mark you unsafe again if you will involve resources means you are going to cost to this NHS any resource involvement. So resources needs to be involved appropriately. 8 gram percent because of menorrhagia, we all know you can manage it. If in spite of that iron infusion, if it is not coming up, then yes, definitely you need to involve. But
Yeah, okay, ma'am.
the first will be always the simple things. We will assume that it is because of her heavy bleeding. No need to involve hematologist, not even a counselor. Okay, the way she has asked, am I coping properly, or how I'm feeling? That's it. That much is only needed. Mental history is not needed, dear, here, because I told you it was difficult time initially, so it is not needed per se. Am I audible?
Ah,
Yes,
yes,
ma'am.
ma'am.
Yes, ma'am.
Yes, ma'am, you
Ma'am,
are.
one
That
question
is.
I wanted to ask, do we need to do an MRI done prior to we take her for surgery?
You can just say that advanced imaging may be required, not necessary that we will be required. If a very good transvaginal ultrasonography we are having, we do not need it basically. Okay, but
O-
you can just say that we may require advanced imaging because we do not know whether that point is there in their answer key or not.
Okay.
Okay, okay. So that's the reason I am saying that we may require advanced imaging, single step, multiple two step. GnRH will help to reduce the bleeding, to reduce this size of the fibroid and ease of procedure. So that GnRH is important thing.
Ma'am, I think if they're doing like a big open myomectomy, they usually do MRI.
Yeah,
Uh,
in
the
yeah, In an open
Not
fibroid,
for
yes. In a big fibroid which is there, then definitely they will go for MRI. Here maybe may not be in this because it's a clear cut. You can very easily see under hysteroscope also. And transvaginal ultrasonography will definitely give us 3D ultrasonography will definitely give us a very good chance. So imaging, advanced imaging includes 3D ultrasonography also. So you can mention if need arises, we may re-repeat. Okay, so we may use imaging to localize it, GnRH, uh, advantage, one procedure, one step, single step or two step. And yes, with this, she might able to conceive on her own, carry forward her pregnancy. If not, then only she will be investigated further. If there will be any difficulty, she will be investigated. Anybody is having
so,
any question again?
yes, ma'am. If she like, at what stage I should ask her like whether you have any concerns or what are your concerns?
In the beginning, okay,
Hmm.
in the beginning, once you have explained the diagnosis, its
Okay.
implication, its treatment, something like that. Okay, so I will say that thrice at least you should ask her concern in the beginning, middle of the station, and by the end. That last 30 seconds at least you should have for any remaining concern if she's having. It's okay if you could not close this task, but addressing concern is patient safety. Okay, so prior to closing a task. So in the beginning, you can very easily ask. In the middle of the things also you can ask, and by the end also you can ask. Okay, so introduction was very good. Communication was very good. Lost baby condolences, coping up strategies you had asked. Aim, very crystal clear in her aim. She has asked me that miscarriage also, and I'm having a open means heavy bleeding, and that's the reason we are seeing you. So both the things she has mixed it very nicely, really very good. Setting agenda, concerns you missed out. History, here I had reversed the order. It's okay whether you wanted to ask about miscarriage or whether you wanted to ask about HMB. It's up to you. Last menstrual period, quality of life, IMB, pain, PCB, anemia, treatment tried, pressure symptoms, bladder and bowel. Red flags includes that IMB and PCB. Okay, any contraception, smear, you had asked that also. Details of obstetric history you had elicited it completely. Explore here any other concern she is having and address. Family history of similar situation, because sometimes fibroid we know. Alcohol, smoking, BMI, medical, surgical, allergy. This is the only history. Alcohol, smoking and BMI, because we need to consider Jehovah Witness also we can think of asking here, because she's having anemia. We may need to consider blood transfusion. Checking knowledge about her hemoglobin and her fibroid is first thing, and then explaining fibroid and checking her fibroid knowledge, that is another knowledge. So this also you have to explain.
Hmm.
Okay, now explain, drawing a diagram is must, and that's the reason I'm putting into my slides. Very nicely you have explained. Explain that it is an innocent growth arises from the muscles of the womb. One sentence, Arthi, which you were not explaining me. So in one sentence, innocent growth, they are not cancerous, you had explained. Why? There might be some reason, okay, many, not exactly we know why. Hormones, estrogen is specially responsible for growth. Implication, heavy menstrual bleeding, which you had mentioned. Sometimes it is associated with miscarriage due to its location, will affect fertility as baby may not get implanted, especially in submucosal fibroids. Okay, so that association might be there. Rarely cancerous, which you had mentioned. So treatment is, now treatment, what I will suggest here, miss, the way you had done it, I am not having anything. You can go ahead in this regard also, and lastly you can tell her that other options are not suitable in her case. Wait and watch, not recommended as she is symptomatic for her fibroid. Medical treatment, symptomatic, try tranexamic acid and painkiller. Continue that till we go ahead with definitive treatment. COC, LNG will not be suitable since she is planning a fertility, and the size is also big for that LNG fitting. Relief, okay. Then GnRH and ulipristal acetate can be she can be offered as a time buying strategy where her hemoglobin will be built up, size will be reduced, ease of procedure will be benefited by this modality. So GnRH and UPA. Surgery, a definitive surgery is hysterectomy, which is not recommended in her case. You can just say one word, go rule out that possibility. Now other options will be surgery to remove the fibroid. So route will be, that is called as myomectomy, since she is into the reproductive age group. My route will be hysteroscopy, which you had explained very nicely. Radiological procedures like uterine artery embolism, MRI guided procedures are there, but it will again not be suitable. It's a big fibroids, and there are risks associated with this. So you have to explain all the pros and cons of all the options. Uh, Pros and cons of the suitable methods, whatever we are discussing. So GnRH, hot flashes, menopausal symptoms. She might experience menopausal symptoms as it is a medical menopause. What we are doing, uh, advantage, minimizes the size. Her hemoglobin will be built up. Her symptomatic relief. Iron supplementation, symptomatic treatment till GnRH also considered till her hemoglobin buildup. Then hysteroscopic resection is the modality of treatment in this case. Want some time? We can discuss you with your partner. Come discuss with the consultant, and then we can go ahead with the plan procedure. Okay. Yes. So a waiting period will be there. She needs to be fit for the procedure. So till that time, she can have another appointment. Then there are website addresses or PIL about this fibroid. British Fibroid Trust is the support group. Always ensure that you will know the support group in and out about the situation, about common conditions, at least for common conditions.